Thank you for your interest in becoming a marrow donor yourself or in helping others get registered. This quick video will give you the top highlights that you'll need to know in registering or helping others get registered. The things we need to go over are who can register, what has to be completed on the forms, and review some answers to common questions that people may have the day of the drive. Before we begin, what is bone marrow and why is this drive so important? Joining the registration database allows for a chance of someone who needs a donor to find a person with a tissue type that matches as closely as possible. When a patient's given a diagnosis of leukemia, lymphoma, severe aplastic anemia, or some other blood-based disease, often the best or only treatment is a bone marrow transplant. Once someone completes the form that you're going to walk through with them, they will be entered into the database in a matter of weeks to months. Someday, if they're called as a match, there will be several steps taken prior to donation. They'll complete a health history questionnaire, provide a blood sample, and go through other testing to make sure that they are the best match for a possible candidate. And they're still given the option of whether they want to go through with this donation. People will probably ask if it hurts to donate because that might be what they have heard. There's multiple ways to donate bone marrow. The more common method is peripheral blood stem cell donation, and this involves the donor taking a medication for 5 days, which will cause the bone to release stem cells into the blood. On the 5th day, these extra cells are then gathered using a special blood filtering machine called apheresis. It's similar to donating blood plasma. However, traditional bone marrow donation involves a small portion of the marrow, which is the soft center of bone, being taken from the hip using a needle. The procedure is done in a hospital setting and the donor is given general anesthesia, so they're not awake and they're given pain medication. People will ask if they're eligible to participate in the program, and the simple answer is that for those between ages 18 and 61 and in any way connected to the military or Department of Defense, whether as an active duty member, dependent, or civilian employee, the answer is generally yes. As long as they don't have an obvious disqualifier, such as having an HIV infection, an immune system disease, or cancer, except for cured localized skin cancer, have them complete the form and it will be evaluated at the next level. The following are common things that people may think will make them ineligible to donate. Those who have had tuberculosis, malaria shots and pills, tattoos or body piercings, lived in the UK during mad cow disease, deployed to Iraq or Afghanistan, or are currently sick with the common cold. All of these people can safely donate. The medical evaluation component can be challenging, so the point of the registration drive is to get all of those without an obvious disqualification, as we've mentioned, to fill out the form and take the 10 minutes to possibly save a life. Their information will be evaluated, so if they are ineligible, this will be discovered at the next stage before their kit undergoes further processing. Let's take a moment to look at the actual registration kit. There's 3 components: the envelope, the collection kit, and the registration form. To make sure a kit is complete and can be processed, please ensure the following. The envelope and the collection kit samples both need to have the required information. You'll see the spaces to ensure that their name and personal information is recorded. When looking at the form, you can see the green arrows are pointing to the required fields which may be missed. The registrant should fill out as much as possible on the form, but if they don't know some information, it's okay. However, they should have at least one good contact, if not 2, so that in the future if they do match, they can be located. Before registering someone else, please take a moment to familiarize yourself with the form so that you will know what to look for. The areas with green arrows are highlighted because they may be missed, especially if you've not helped with an event before. The very first question, asking if someone has registered in the past, should be selected as no if someone is going to continue. If they say yes, the kit will likely not be processed. 2 contacts are important and are shown on the screen with the green arrow. On the Privacy Act statement page, the candidate should sign and date that they've read the information. And on the final form, after the information is complete, you, if you're helping with the event, should sign and date the form as a witness. Thank you for donating your time to this worthy cause. Just remember, your enthusiasm is going to ensure the success of the drive. Please review the information emailed to you by the coordinator for your drive and advise them with any questions you still may have. Thank you for your time.